started, and then you can kick it off. And you're good to go, Leila.
Okay, welcome everyone. I know that we're just admitting some people, so I might give us 30 seconds. We have a number of people still joining. Our Teams is a little bit slow. So in 30 seconds or so, I will kick off the meeting. So hang tight for now. Actually, no, it looks like no, we're still got more people joining. All right, well, I will kick it off. Welcome, everyone. It's nice to see you back again. If you're back again as a returning visitor to our Petro-Canada Caremakers Foundation Grant Information Center session. My name is Leila Fence, and I am the Executive Director of the Petro-Canada Caremakers Foundation. We are really excited to have you join us today. I have myself and Ibukon Adewale on the line to give you all the information you're going to need to how to apply for a grant from the Petro-Canada Caremakers Foundation. So we still have a few people joining, so we will. Well, I think that might be good. So Ibukon, I will hand it over to you to take us through the land acknowledgement.
Thank you, Leila. I'd like to acknowledge that we're joining you today from Calgary on the traditional territories of the people of Treaty 7 in southern Alberta. This includes the Blackfoot Confederacy, the Siksika, Piikani, Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda Nations, including Chiniki, Bespaw, and Goodstoney First Nations. Calgary is also home to Métis Nation of Alberta Region 3. My family and I have called Calgary home for the past 8 years, so this acknowledgement feels personal as well as important. It's a reminder for me to pause and reflect on the history of this land and the communities who cared for it for generations. So I invite you to take a moment to reflect on the land you're joining from today. And before we get into our presentation, let me give you a quick sense of what we'll be covering today. We'll start with an overview of the foundation, then walk through our 2026 funding priorities or opportunities. We'll also go through who can apply and how the application process works. We'll also share some practical tips for preparing a strong application. And then at the end, we'll have some time to answer all your questions. If anything comes to mind during the session, please feel free to drop your questions in the chat box. The Q&A button, which is at the top of your screen, is active, so feel free to chat, to drop all your questions in there, and then we'll address it at the end of the call. And I'll pass it back to Leila to talk about the foundation.
Thanks very much, Ibukon. I'm excited to see that we have over 100 people already on the call. Many of you may be new, many of you are not new. So if we could advance to the next slide, thank you. I'll just talk a little bit about the Petro-Canada Caremakers Foundation. Some of you may have heard this information before, but we were founded in November of 2020. It's hard to believe that we've just passed our 5-year anniversary now, but we were founded with the goal of focusing on the single cause of supporting family caregivers. Family caregivers, as I'm sure you know, are those people who are really providing substantive support to a family member or loved one who is experiencing a significant mental or physical health challenge or condition related to aging. This is a cause that has been unseen largely in Canadian society, and not many corporations have really been turning their attention to it. So, as a foundation, when we launched, we set forward our vision statement, which was a Canada where family caregivers are valued, recognized, and supported. And that seems so simple on the surface, but it's something that's really hard to do. How do we try to work towards this vision statement as a foundation? We do it around working primarily in 4 pillars. One thing that we tried to do is really raise awareness of what a family caregiver is and help people identify as a family caregiver. We know that until people acknowledge themselves as a family caregiver who's doing something extraordinary, they're not likely to reach out and recognize that there is support and resources available to them. So the idea of raising awareness is a very, very important part of what the foundation does every year. One of the most important things that we do, well, they're all important, but one of the reasons why you're on this call is because we also provide grants to registered charities in Canada that are supporting family caregivers on the front line. We are so proud of the fact that since we've launched 5 years ago, we have provided more than $16 million to organizations like yours across the country who are really supporting family caregivers. In order to fund all of this great work, we do a number of fundraising activities as well. We have raised over $12 million through different events and different initiatives, all of which go straight back out into supporting amazing organizations like yours. And then we also try to collaborate with sector leaders wherever we can. We are a small foundation team, but we work very well with all of the organizations that we fund and also with the provincial organizations that are really often the first stop for family caregivers when they're seeking support. So that's what we do as a foundation. And with that, I'll ask you to go to the next slide. I mentioned that we funded over $60 million to charities across the country. Here's a bit of a provincial breakdown. We're a little bit heavily weighted right now in Alberta and Ontario. Maybe not that surprising considering a lot of the Ontario organizations have a national scale. We have a bit of a void right now up in the territory, so we're really hoping that maybe there's some people on this call who are currently up there providing wonderful supports to family caregivers. We'd love to see some applications from Yukon, Nunavut, or from the Northwest Territories. Like that would just make our day. But you can see a little bit of the breakdown where we have funded, both on our national and our local grants. We funded a number of key areas and they're listed on the right. I won't go through them all, but we find that the things that family caregivers are most often interested in getting support in are respite, improved mental health. There's a lot of strain and stress that comes from being a family caregiver. So often people are looking for mental health supports. Community and connection. People often feel alone when they're supporting family caregivers. So if you're offering either peer counseling or social connections, that's a really important avenue for family caregivers to lean on. And then enhanced coping skills, whether that's tools, confidence, research to help whatever the condition that you're supporting is. There's so many wonderful ways that your organizations are supporting family caregivers. So that's my 3-minute overview of what the Petro-Canada Caremakers Foundation does. Thank you very much. I think we have over 100 and almost 110 people on the call right now. And with that, I will hand it back to Ibacon, who will answer all of your questions. But thanks very much for joining us. And I'm around if anybody wants to ask me anything. Over to you, Ibacon.
Thank you, Leila. And as we touched on earlier, one of the foundation, as Leila mentioned, actually, is that one of the foundation's core commitment is providing funding to charities that support family caregivers. And as in previous years, organizations can still apply under two grant streams. We have the national grants and the local grants. So starting with the national grant stream, this is intended for organizations leading projects or initiatives with broader impacts. And usually we look at organizations that are impacting nationally, regionally, provincially, and their work supports or addresses systemic challenges facing family caregivers. We also look for work that advances thought leadership and research. We look for work that brings about, innovative solutions, and also work that supports, creating tools and providing resources to family caregivers, because we realize that that's a big area of gap that family caregivers need support around. And for the national grants, organizations can apply for up to 300,000 through this grant stream. The application portal is opening this Friday. Yay. So please get ready to put in your applications. It's going to be open from July 3rd to the 14th of August, 6 weeks. And we would announce the award in December. Our local grants are intended for organizations providing direct and community-based support to family caregivers. And we'll touch on some examples in a bit. But the things we look out for are things like educational programs, transportation, meal assistance, respite care, emotion and community support, and healthcare navigation. The local grants are a fixed amount of $7,500 per organization, and the application portal for the local grants will be opening on the 4th of September and will close on the 16th of October. And we usually award that in February of the following year. So award notification would happen in February of 2027. So we wanted to feature some of our grantees, and I would encourage you to please go on our YouTube channel because we do have a lot of videos that we have done. I think over 12, just featuring some of our national grant recipients to get a better feel of some of the programs that we have funded. But this one example is one of a national grant. It's Caregivers Nova Scotia, and they receive funding for the Can Care project. And this project focuses on an important and often overlooked issue amongst family caregivers. So these are family caregivers who may be experiencing intimate partner violence while also caring for a spouse with mental or physical decline. So what stood out about this project is that it responds to a complex community need with a thoughtful and research-informed approach. And the work includes interviews, research, multi-sector collaboration to help develop a Canadian support program. So we're sharing this example to highlight the kinds of impactful, responsive, and evidence-informed initiatives that our funding can support. And for the next slide, this one is a strong example of how a local grant can make a real difference in people's lives every day. So through the Reducing the Burden project, the Kidney Foundation of Canada's Manitoba branch is helping dialysis and transplant patients, along with their caregivers, manage some of their financial strain that come with treatment and care. And we know that a lot of family caregivers talk about the challenges regarding finances. So in addition to covering essential costs, the project also recognizes that caregivers need support too. So, by offering mental health workshops, peer groups, and practical education, it takes a more holistic approach to caregivers' well being. Again, we wanted to highlight this example because it reflects the kind of community based, responsive support our funding can help achieve a difference. So now that we've talked about some of the ones that we have funded, how do you determine if you're eligible? So we wanted to share this slide. Applicants must be Canadian registered charities who have good standing with the CRA and have the caregiving focused mission. For the local grants in particular, the organizations must be able to deliver programs that respond to the needs of family caregivers in their community. And I've also listed some common examples of ineligible requests, such as advertising, fundraising campaigns, because we do get a lot of requests asking us, if we could fund fundraising campaigns. We are unable to. We're also unable to fund event sponsorships. And unfortunately, we cannot support individual family caregivers or family members. We wanted to provide clarity upfront so that your organization is a good fit before you put in an application. So now that we've covered eligibility, here's a look at how the application and review process works. So this slide walks through the overall process from application to decision. Now, once the portal opens, the first step is for you as an organization, is to review the eligibility criteria and confirm that your organization and project are a good fit. So you might want to go the national grant route or the local grant route, but that would determine based on the eligibility of your organization. And from there, applications move through different review paths depending on the grant type again. National grants follow a more in-depth review process that may include research, data gathering. We'll reach out to you at some point for interviews before we take our recommendation to the board. The local grants, on the other hand, go through screening review by our local grant advisory committee. And then after that, we review it as an organization before we also take it to the board. I think the main takeaway here for both grant streams is to know that we have a structured review process and the final funding decision lies with our board of directors. This is usually a frequently asked question, but we thought we'll just call it out also separately. So reporting guidelines, we often get asked if we do have a template and all of that. But really for the national grants, we expect 2 reports from the organizations that end up receiving funding from us. So they would send us a mid-grant report, which is about six months into the granting period, and would expect one at the end of the grant period, which is usually calendar year or the financial year of the organization. And for the local grants, we require just 1 report, which is at the end of the grant period as well. And in those reports, like I said, we don't have a template, but we provide guidelines. So we're looking for things like the outcomes achieved, some data on reach and participation. We also like to know if you've experienced any challenges that came up and how you manage those, if there are any key learnings. And generally, we want to know the overall impact of the work that we have funded. And we encourage you to send us quotes, testimonials, and high resolution images where available, because they help us understand better your work and also to be able to tell compelling stories. I think I will move to the next slide now. Okay, so we also wanted to touch on some application tips based on the things that we have seen over the years. So first, I would talk on things around guidelines. please make sure you're a strong fit before you apply for a grant stream. You could choose the national, you could choose the local, you could actually apply for both, but I'll talk about that in a bit under frequently asked questions. For local grants, there's a practical step that you need to ensure before you apply. So payments are usually made via Benevity, so please ensure that you have an active profile with Benevity because oftentimes that just slows down the process of payment. And then as you complete the application, it's so important that your application is clear. We noticed that some of the strongest applications are the ones that are specific. They're easy to follow and understand. So it's important that you clearly explain the need that you're trying to address as it relates to family caregiving, why the work you're doing matters, the approach that you're taking, and what the impact is going to be on your organization and on family caregivers as a whole. So we also want to call out that for our grants, routine parenting does not fall within our definition of family caregiving, also because we've seen a lot of people apply for funding within that space. So our funding really is intended for those who are supporting family caregivers or loved ones, and these are people that are unpaid, who have chronic illnesses, disability, or an age-related disease. So we do have some list of frequently asked questions that I think we'll go over before I hand it to Anna to moderate the chat box. I hope people have been popping their chats inside, and I will be handling that in a sec. But we'll just go through some of the ones we have received. So, and Leila, feel free to answer some of these questions. So, on eligibility and applying, so one of the questions we get asked often is, are some types of project prioritized over others? Generally, we don't prioritize any project over others, but we do look at the suites of projects we have funded in the past. We try not to duplicate, but basically it's based on the need within that community organization. So for us, the need, the impact or the description that you have provided to us on how important that need is will determine who gets or if your project will be funded, but we generally don't prioritize anything. For the next question, can we apply for funding for an existing program or does it need to be a new initiative? It doesn't have to be a new initiative. Existing programs, I think, are very good in the sense that you've demonstrated record on how that program has impacted family caregivers so far. So existing programs are very much welcome, and new initiatives too are very much welcome because oftentimes new initiatives are based on a need that you have seen or a gap that needs to be filled. So we encourage you to apply regardless. The next question is, can organizations apply again if they've received funding in the previous year? Yes, you can apply again. Again, we've had situations where we funded organizations in a row, and we've had situations where we encourage you to just keep applying because you just never know if you will get a funding. We're unable to say upfront anything until we receive the application until we receive the application and review it. So we just encourage you to apply. Can an organization submit more than one application? We highly discourage this so that because we want to be fair and transparent, and it also will give us enough time to review the applications. If one organization is submitting 3-4 applications, it just makes it hard for us to go through the review process. So we discourage you from applying for more than one for one grant stream. So if you're applying for the national grant, only one application. If you're applying for the local grant, just one application. But you can apply for either the national or the local in a given year. The only caveat is we're only able to fund one. So if you get the national grant, you would not qualify for the local grant. And if you get the local grant, well, I would say if you get the national, you won't get the local because the national grant is awarded way before the local grant. So yes, you can apply for either or, but you'll only be awarded one. The next question is, can an organization apply to both the national? I think I just touched on that. So yes, you can apply to both the national and local grant stream. Does our organization need prior experience delivering caregiver focused programs? We highly encourage this because family caregiving is really core to what we want to fund, and we want to ensure that we're funding the right programs. So we want to ensure that all organizations who are applying have a strong caregiving component in their program. So yeah, that's an important criteria. On timing and process, how many grants will be awarded this year? Maybe I'll ask Leila to talk about this.
We don't have a set number or a target that we have every year. We really review what comes into us. We have a budget, which we know that we want to be able to fund. We don't have unlimited funds. We need to go out and raise the funds every year, and then we also try to make sure that we're not funding only in one province. We saw there were some areas when we looked at the map that we don't get a lot of applications for. If you happen to live in one of those areas, I would say that your odds of getting funded are greater as opposed to maybe in Ontario where there's an extremely competitive marketplace. So we don't have a target. On average, I would say we fund between 15 and 25 national grants a year, but don't take that as gospel by any means. So that's more or less what we do.
Yeah, and I think just to add to that, last year we did over 3 million in grants. So I guess that could give you an idea of the total sum. But like Leila said, we don't have unlimited pool of funds. We would love to fund everyone, frankly. But that's just a challenge we always have to deal with. So the next question is, when will applications be notified, or frequently asked question? So what we do with the national grants, we usually notify after our board reviews and approve. So we notify for national grants in November, and payment is usually made before Christmas. And then for the local grants, we usually notify sometime in February, and we go through the beneficiary channels to make the payment. So payments are usually out by April. The next question is, can late applications be accepted? Unfortunately, no, because the portal is open for a particular period. So when it closes, it closes. We encourage you to apply early. We've had situations whereby people wait until a day or 2 days before their technical issues, or even it could be from, I don't know where the technical issues come from, frankly, but we've seen situations where people just reach out and say the application can't go through, or they lost what they saved and all of that. So it's always early. It's always good to get it in early. And then if there are any challenges, please just raise it early so that we can intervene in a timely manner. How many grants will be awarded this year? I guess Leila just touched on that, so I'll skip so that we can have some time to answer questions from folks. If we don't hear back right away, should we assume our application was unsuccessful? I would say no, because we've just given you a heads up. It does take some time before you hear back from us, but we communicate with everyone. So hang in there. Don't give up until you hear that it's either been approved or unfortunately regretted. And then, can we meet with your team to discuss our project after the session? It's becoming increasingly hard to meet with everyone. We've tried to open it, but as our grants have increased over years, I think we started with, now we're doing 150 local grants. We started with like 60, 70. It's almost so hard to make time for everyone. But if you could send us an email, we'll try to respond promptly. Okay, quick questions and submitted applications and follow-up. Will funded organizations be publicly announced? We do share that on our website. We do share also on our social channels. And oftentimes, some of the organizations that we've awarded to also do press releases to announce. They share on their own social channels and websites as well. So I guess that's how we get the word out. I think I will put a pause and come back to this. Maybe we should take some questions. And then if we do have any more time, I'll come back to touch on some of this. Anna, do we have any questions in the chat box?
Oh, for sure. So
Okay.
Juanita and Lenore asked, will this presentation be sent out? Yes, it
Yeah,
will.
so it will be it's being recorded and we'll share with everyone who registered.
Okay, thank you. Ashley Doyle asks, is this grant specifically for aging adults? Our charity focuses on caregivers of sick children.
So our grants are open to all forms of family caregivers. So it could be a parent caring for a child who has autism or Down syndrome. It could be a partner caring for their spouse who has cancer. It could be a child caring for her aging parent. It could be anyone just caring for someone with this dementia. As long as the organization is supporting someone who has a significant health issue, you can qualify for any of the grant streams.
Perfect. Mandy Paisley asks, is this grant open to foster caregivers, including kinship caregivers?
Leila, do you want to take that one?
I think so, as long as we're meeting the definition of it being a person that's being cared for with a significant mental or physical health challenge or condition related to aging. We don't define family caregiver as being a biological family. We use the chosen family approach to how we define family. So, if a foster care or a kin family is how you define your family, then we're open to that. The one thing that we would say that is foster families are often shorter engagements. So, if it's a 2-month placement, maybe that's not something that's a long-term committed placement. That's the one thing that we may just look at a little bit.
Hmm.
Michael
Thank you for
Gomes
that.
asks, can you clarify what is meant by support for a specific caregiver or family caring for a loved one? How are they ineligible?
Okay, so when we say that, we mean we actually don't give direct funds to individuals. So we're unable to give funds to, for example, if somebody were to write us to say, oh, my loved one has this situation and I've been caring for them, of which we do get those kind of requests, we're unable to fund individuals directly or their family member. Having said that, we do fund charities. So the funding channel is through charities. So we expect family caregivers are connected to the right organizations, and then they can get the required support through that channel.
Kelly Paley asks, is there a way to ensure we're up to date on our reporting requirements?
Yes. So one of the things we do is send reminders when they're due to just tell you it's coming to the 6-month mark for the national grants. We're expecting your report. And then towards the end, we do send another report for both national and local. But oftentimes we've also seen situations whereby the programs are completed before even the expected time. So we do get the reports. And we've seen situations also where programs have had to extend for whatever reason. So we are able to extend the reporting requirement. We're not able to continue to fund if you go over the funding period. But yeah, we're flexible with regards to the reporting.
Brenda Linehan asks, as a non-for-profit, can we have one of our charitable partners act as a fiduciary on our application?
Yes, we do encourage partnerships with registered charities. So the registered charity would be the one to apply. The funds will be sent to the registered charity if they do qualify for the grant, and then we would expect reporting requirements and all of that with the registered charity. I would just say that also we always like to understand the relationship you have with the registered charity if we were to award the grant. So, but we do encourage such partnerships.
Heather Scott asks, can a hospital foundation apply for a program that supports families in hospitals? We have a program that supports families with medical stays for children.
Mila, should I hand that over to you?
Sure. We have had a number of hospital foundations apply, and so often hospitals have quite robust programs to support family caregivers that are supporting family members while they're there or when they exit care. So I would encourage you to apply. I might also jump in, and I'm jumping the gun and answer my own question, if you don't mind, Ibicon. We often get asked, and it may still come up, your national grant funds projects up to $300,000. Should I apply for $300,000? And I would say, please don't. It's amazing. We get so many applications that are $299.99. Really only apply for what your program needs, and that will allow us to fund more charities. Not everything will be $300,000 fixed, but really be a little bit frank and realistic about what your program will actually cost and put in the real costs, if you don't mind. So that's just one thing I wanted to add. Back to you, Eva and Anna.
Thank you. Karen asks, can you explain again what is an example of a national project that has national relevance?
So one of the ones I would call out is Sick Kids, whereby they help family caregivers transition their loved ones from the hospital to the homes. So we all know Sick Kids. It's easy for people to, I know it's expensive for a lot of family caregivers to be able to travel, but the way they've set up the support is anyone can access the portal and then they can get the required support they need. So rather than quickly take their loved ones, or the first point of call is no longer to go to the emerge, but to quickly check, is there resource for me on the portal? They have a dedicated nurse that supports them. So that project I feel has a national scope because almost anybody, regardless of where they're living, but have received support from Sick Kids, have access to that portal. And then there are also some other ones that we have funded within the provincial organizations, whereby there is a support line where people can call from almost anywhere to get support. So that also has like a national reach. There are also some programs that we have funded, which are like webinars and calls or online support system, whereby we know that it's almost hard for family caregivers to show up in person because they need that time with their loved ones. So people get support from across the country, and just reach out to those organizations and just say, you know what, I know you're based in Alberta, but I'm based in a remote area. How do I get support? So they do get support, especially as it relates to system navigation. Also, one of the things I would call out is because we know how fragmented our provincial health system is, oftentimes it's limited to a province. So we do look at programs nationally. We also consider provincial support and regional supports for family caregivers. So I hope that answers your question.
Thank you, Bakan. Nancy Christian asks, we are a society and offer support programs for caregivers of individuals that are impacted with FAACD. Can we apply as a society?
So I think that would depend on how you're registered with the CRA. So are you a charitable organization and do you have a valid standing with CRA? Because we do go through all of that before we do eventually award a grant. So we will check the CRA qualified donor listing to see if you qualify, and then we're able to award the grant. So I guess you just have to ensure that you have the right standing with the CRA if you're registered, and then you can put in an application.
Thank you. Lenore Cabral is asking, please provide clarification on national impact if I do a caregiver support group in the York region.
Can you go over that again?
Please provide clarification on national impact if I do caregiver support group in the York region.
So I think it would be very helpful if we see the full application, because that way we understand who the program is going to be impacting, and how you want to implement the program. So I would encourage you to just apply and then provide us with as much information as possible.
Okay, thank you. Claire Hughes is asking, would counseling for families that have experienced domestic violence qualify if both the adults and children have been impacted by violence, but the parents are still caring for the child with mental health challenges due to the violence? Or can the caregiver not be experiencing health challenges themselves for this funding?
So we generally look at first, I think the baseline is to define who the family caregiver is. If we can establish that there's a family caregiver involved, then how can we support that family caregiver? So domestic violence could come as a result of being a family caregiver. We understand how high pressure, it is to actually be caring for a loved one. And one of the things we've come to understand over time is sometimes caring for a loved one, it's not always coming from a place of love. Sometimes it's actually hard, but people just take up the duty because they feel they should. So we want to be sure that the family caregiver is getting the support. So it's important, if you're submitting an application, to let us understand what the situation is with the family caregiver, what is the challenge, how are you closing that gap, and then we can decide if it would be a good fit for us to fund.
Lacey Kempinski is asking, we are a nationally federated organization with national and provincial offices. Can all provincial offices apply as they have separate charitable registration numbers, or is it a consolidated approach better? Thank you.
So we've seen a lot of that as well. We funded also similar organizations like that. So I would say for the national grant, it makes sense for the national body to apply. And for the provincial ones, they could also apply for the national grant if they can demonstrate how their program is going to have a national reach. But from what I've seen, we tend to fund them under the local grants. So most of the applications from the provincial or regional orgs usually coming under the local grants. And then we've generally seen situations whereby we're funded. I'll call out maybe the Alzheimer's Society. We've had ALS Alberta that we funded. So we do see a lot of that.
Thank you. Layla, I know you touched on this briefly, but Logan Barnes is asking, if you are from one of the provinces that received a majority of support like Ontario or Alberta, will it have less of a chance being accepted over other provinces?
I would say not necessarily. There are a lot of very worthy organizations that come to us out of Alberta and Ontario. I would say that we look at each application as it comes in. We don't have a set number that we're going to fund in each province. So there's a chance that if tons of great applications come in from Ontario, we will fund more in Ontario. But that being said, I would say your chances are greater of being funded. If we get 3 applicants from, say, the Yukon, we're going to probably give them a little bit more weighting. So not less, but more if you come to us from a less application filled province, if that makes sense. So not really a negative if you come from one of the very populated provinces, but you're going to have a higher chance if you come from one of the negative desert application provinces.
Thank you. Stephen Phillips asks, does the foundation fund a multi-pronged holistic approach to caregiving, or is a singular approach preferred? For example, a provincial education program for skills support groups for ongoing community and care.
So we usually do single year funds just because we don't have unlimited pool of funds. Our fundraiser does a fantastic job bringing in money every year, but we don't know how much we have. So we're unable to commit to multi-year funding for programs. But we do encourage you to apply again. So like I said, we've seen situations whereby we funded an organization 2 times in a row, 3 times in a row. But again, it's just single year and there's no guarantee that you'll get the funding.
I'm just going to jump in there a little bit too. I think in addition to that, we were asking about a multi-pronged approach to care. As long as you can apply for however you want to package it. It has to be focused on family care specifically, as opposed to wraparound societal care that are contributing to the conditions that is requiring them to need help. So I would say focus on the family caregivers, and if it's a holistic approach that you want to take, you can apply for that, but it has to be focused on family caregivers and not sort of a broader societal need.
Thank you. Renee is asking, one of our key programs is individualized support for families to help them get what they need to assist their family members with a disability. Do you anticipate that our mission could be considered to be aligned with the intent of the Caremaker grant?
Sorry, could you just read that again?
For sure. Sorry, I speak a little
Thank
fast.
you. No, it's okay.
One of our key programs is individualized support for families to help them get what they need to assist their family members with a disability. Do you anticipate that our mission could be considered to be aligned with the intent of the Caremaker grant?
I guess so. I guess I would say that we know that with the way family caregiving is, oftentimes it's not just one person that steps up. Sometimes the whole family is involved. So the baseline again is there a family caregiver in the situation, and how is your program that you're proposing going to be supporting that family caregiver? In this case, I hear that it's family caregivers, families who are supporting people with disabilities. So I would say it qualifies if you can call out the family caregiving component and what the real issue is.
Thank you. Marcia is asking, if our scope is solely provincial, would our application be disqualified for the national grant?
I wanted to take that, but I think I'll ask Leila too.
Say no. You can still apply. What we often find is that organizations who work on a provincial scale, the programs that they're developing are scalable and could then be taken, not necessarily by your organization, but they could have the ability to be scaled nationally. So I would say that large scale organizations that are funding across a larger region, I would apply for a national grant.
Yeah.
Thank you. Alana Shapiro is asking, did you say that for local grants you fund roughly 15 to 25? I thought you said that, but then you said 100 charities.
Oh, sorry about that. So for the local grants last year, we did 150. When we started, I think we started at 60. I was just trying to explain that we've grown significantly in the last 5 years and we're continuing to grow. So I think for the minimum this year, we'll do 150, but Leila can let us know if we're able to do slightly more.
Yeah, we'll see it. We'll see what our budget looks like. But local grants, because they're a fixed grant of $7,500, we do more, and it allows us to fund much more smaller organizations that are really targeted from a geography standpoint. So fixed grant, $7,500. We did 150 last year. For the larger national grants, which are up to $300,000, we did between 15 and 25, and we'll probably be somewhere in that range based on what each program comes in with a cost of.
Perfect. Dravik Canada is asking if we start the program over the summer and pay some of the invoices for it and then are successful for a national grant, can we claim the paid invoices against the grant?
We generally don't go with that approach, but oftentimes we've seen that the program already exists. So we've seen situations whereby the organization is running an activity already and the funding is a bonus or it's something that just worked perfectly for the organization. But we would say don't implement a program with an assurance that you'll get the funding, because until we inform you that you've gotten the funding, it's such a huge risk to the program itself to start, and then for some reason you're unable to progress. But we've seen situations whereby people have already, because for existing programs, they exist. So we just fund based on the application that has come in, and organizations are able to build on the good work they're doing already.
I just want to add a little bit. When we think
Yeah.
about, I know different funding organizations have different requirements. We are not going to go through your budget line by line and ask to see all of your receipts in this way. You will prepare a proposal based with your total budget, and then we'll look at that. But we're not as granular as expecting to approve every expense, and we're not going to go through it line by line. So I think Ibicon raised a really good point. Like, if your work is continuing, then you should apply. And I'll leave it at that.
Thank you. Brenda is asking, do we need to engage in direct delivery to family caregivers? The national grants look like a fit for our project, but we are working more on engagement with family caregivers and translating that into systems level policy work. Is this considered thought leadership and alleviating systemic challenges?
I think it would be helpful, honestly, to read the application as a whole, because if we do comment, we don't have the full scope of the project itself. But it sounds, from what I hear, it sounds like something that would be a good fit for the national grant. But it will be best for us to review the whole application to be able to comment.
I agree with what you just said, Ibicon, but I would also add, it does sound like it could be a great fit. Not all of the national grants are providing direct service delivery. Some are research on conditions, some are systems thinking. So absolutely, that sounds like it might be relevant.
Yeah.
Margot Buckley has a question around bereavement support. If your program supports granting wishes to terminally ill adults across Canada with a strong outcome of respite for the family member who has cared for them and a sense of closure before death, is that a strong outcome for support? This would fund travel to bring family together before death.
Yes, we've funded bereavement support in the past, and we understand that it's all part of the caregiving process. So again, until we see the application, but it sounds like something that would qualify for one of our grant streams.
Thank you. Susie Wilcox asks, could you please let us know if you give feedback on applications that are not selected?
So we do try. For everyone that reaches out, we respond. We do let you know. I think Leila touched on one of the biggest challenges. Oftentimes, it's not because the application wasn't great. It's just because we do have a huge challenge on our part. We have limited pool of funds. So we try, like Leila said, if you keep your request within a reasonable amount, the funds are able to go around. And during the interviews as well, we do engage some of the organizations to determine the right amount for that activity, and we're able to get some more funds to spread out. So we provide feedback. We just would say upfront that the real challenge is that we just cannot fund everyone as much as we would love to.
Thank you.
Jump in here as well. If you reach out to us, we will provide feedback. We are a small team. You're pretty much looking at the entire team on this call. There is Ibicon, who is our lead for all of our charitable grant making work. And there's her, and there's her, and there's me. So we had last year national grants, I think almost 400 organizations apply. If it's really important to you, we'll do our best. That's all we can commit to. But we try.
Thank you. Seniors NL asks, will the application be provided in PDF format or is it only available online when submitting? If it is only online, does it allow you to save as you complete each section?
Yes, so it's going to be available only online. We usually use the Benevity platform. It's the same that we've used in the last 5 years, so nothing has changed on that front. You can move through the applications. You can also collaborate with your colleagues to complete the application together, so other people within your organization can have access. And then when you're done, you can download the application and save a copy. So yeah.
Courtney Benzel asks, do nonprofit organizations meet eligibility requirements or is it just open to registered charities?
So because of the way we're set up with the CRA, we're essentially set up to provide grants to just registered charity. And we know that the CRA is starting to make some changes within that space, which means that for us, we may have to change the way we're registered. But currently, we only give grants to registered Canadian charities. Having said that, we encourage you to collaborate with charities who you have a good relationship with and can demonstrate how that relationship works to access one of our grant streams.
Thank you. Angela asks, our nonprofit has a program that supports respite care for family caregivers of older adults with health issues. Would this be covered under the grant?
Non-profits. So I guess
Yeah.
what I hear is non-profits, and I know that's not a mistake. So except you have a registered charitable organization status, then you can apply. Otherwise, you may want to explore partnership with another charity.
Thank you. Michael Gomes asks again, can you clarify if you can apply for the national grant if the program is delivered to families in a region of Ontario, or does the program need to be available to more than one province?
I think Leila answered this. We encourage you to apply. We've seen situations where we funded regional, provincial under the national grant stream. So I won't limit it. If you're doing great work, you can demonstrate how the work you're doing is impacting family caregivers. Put in an application.
Brad asks, are partnerships valuable and are support letters valuable? I mean, in regards to the application, I'm assuming.
We generally don't look at those, but you have a section where you can provide supporting documents. And if you feel that it would make your application stand out, please upload one and we'll take it into consideration as we review your application. Because we also know that sometimes some programs are new and those letters can make a difference or provide some more credibility to the program. So feel free to upload it under the supporting documents section. But I'll just add that it's not one of our requirements. So except you feel like it would really make your application stand out, then yes. How we doing with
Julio,
questions?
oh, sorry, sorry.
No, go on.
Julio asks, is it possible to serve as the lead agency partnering with other agencies that support and provide services to deliver the program?
Leila, do you want to take that?
For sure. If you wanted to put together a collaborative proposal, that's fine. We will be funding the actual funds to only the lead agency, and then we will need to understand the governance structure and how you're going to distribute those funds to your partner organizations. But that's an opportunity for sure.
Perfect, thank you. Osifo asks, for the local grant, does the development of tools and other technology that help support family caregivers qualify?
Absolutely. Absolutely. It's a need for family caregivers. So yes. And we funded programs like that as well.
I think we've got all the questions.
Oh, that's good.
I'm
Thank you
just looking
so
through all of
much.
them
Okay, so
to
while
make
you're
sure I
doing that,
didn't miss anyone.
I'll look at my list and see if there's anyone that we didn't answer or no one asked. Are grantees permitted to change? Okay, so this one I will touch on it quickly. Are grantees permitted to change how grant funds are allocated after approval? So usually, like Leila said, we don't go through your funding report or how you spend. We don't ask you for a breakdown, but we do expect that the funds are used in line with what it was approved for. Now, if there are situations whereby you've had to change the program or evolve things, we'd like to know about that. But essentially, we want to make sure that whatever program that you have come up with is still supporting family caregivers. So if you had to come with us with a challenge and say, you know what, this is not going as planned, this is our recovery. We're looking at the recovery from the lens of its support for family caregivers.
Lori asks, what is the maximum percentage of a program you would fund?
What is maximum? What?
Maximum percentage.
I'll
We
jump in on
usually,
that one,
okay.
if that's okay, Yvonne.
Sure.
It depends on the program. I know that that's a vague answer, but it depends. You know, we understand that in some instances we have contributed really a smaller portion for a very large scale grant. Some of the large hospital foundations were funding programs that are several $1 million. We can't fund that entire amount. We can only fund up to $300,000. So that's only a small portion of the funding. We will ask you at that point if you're confident you'll be able to find the funding to actually allow the program to go forward. But if it's 100% of a $300,000 program, we'll do that. If 300,000 is only 10% of a $3 million program and you're confident you can get the rest of the funding, then we'll look at that as well. So I would say it depends.
Yeah.
That was the last question I found.
Okay, and we have like 8 minutes. So I have one final slide. So you can contact us with all your grant related questions. The email is info@caremakers.ca. You can find all of this on our website, by the way. So as it relates to grants, if you're having technical issues, please contact grants@benevity.com. They will sort you out. Oftentimes when people reach out to me, I still refer you back to grants@benevity.com. So that should be the first line of call. If you're still having issues, you can always just send us an email and we'll see how we can connect you with the right support at Benevity. Our website is www.caremakers.ca. So please on Friday, go on there, start reviewing the application portal and put in your application for either the national or in September, the local grants portal will open. And to see more of our work, you'll find it on YouTube. We're on Facebook. We're active on Instagram, and more recently, we're now on LinkedIn. So if you're not following us or connecting with us on LinkedIn, please make sure you connect with us. That we post all of the things that we're doing, all the charities we've worked with, updates, announcements, news. You'll find it all on our social channels. And I think I'll hand it back to Leila to just close it out. But it's been a good session. So Leila, over to you.
It's been a great session. Nice job, Yvonne. Thank you very much, everyone, for coming and sitting through our presentation. We had great participation. I was so pleased to see 100 plus people. So I look forward to receiving more than 100 applications through both our national and local grant streams. If you have any of the questions or further comments, do reach out to the contact us page there. I think the one question that I think we answered, but I'm not 100% clear on, is where will this presentation be hosted if people want to look at it again? Are we going to put it on our website, Yvonne?
Yes, it's going to go on our website and it will be on our YouTube as well. But it's on our website if you wanted to get access to it.
Okay, well then thank you everyone for joining. I think that's it from us, and we really are looking forward to seeing all of your applications and celebrating the great work that you do. So thank you.